Hi guys, you're welcome to Diverse Nutrition Academy Center. My name is Mercy Bello and I am a registered dietitian. Just in case it's your first time watching our video, you want to subscribe to our channel because we normally talk about everything about food, nutrition and wellness. However, today is just to answer a very few questions and the video is not going to be too long. Okay, so normally some people have asked me before, did you say you are a dietitian? And I say yes. They say then, so what do you do? What's a dietitian? So that's why I decided that I will do this video just in case there are a few people out there who are not really too sure what dietitians are, okay, or who a dietitian is or what they do. So let's dive right in. So what's a dietitian? Dietitians are qualified health professionals, okay. They are trained in the field of nutrition. Then they acquire additional training that makes them to be qualified and registered to be able to provide dietary treatments for medical conditions that can benefit from dietary management. Okay, does that make sense? So every dietitian is a nutritionist. However, not every nutritionist is a dietitian. The reason is that before you can become a dietitian, you have to first of all be trained in the nutrition field, and then you will be trained extra to become a qualified dietitian. In other words, the title dietitian is a protected title by law. That means you cannot just call yourself a dietitian if you haven't gone through the formal training that is required to make you qualified as a dietitian. Okay, so apart from this general definition, in practical terms, what do dietitians do? So dietitians actually will carry out nutritional assessment of either a patient that is very ill or a patient who has a chronic condition. Okay, for example, there are patients who are ill and they are in hospital on admission. The dietitian works with them to ensure that they are not at risk of nutritional deficiency, like they are not at risk of dying from lack of nutrition. Okay, if that explains it is better. So we work with various patient groups, from the patients who have undergone surgeries to the patients who are unable to feed by mouth. So we have an aspect of dietetics that's called the enteral feeding, okay, and many more. So that is in the acute setting. We also work in the outpatient setting. What that means is that when patients have been discharged from the hospital, for example, and we think that they will still benefit from dietetic support while at home before they recover fully, then we can book them in to come from home to come and attend a clinic. Okay, so we work with patients in the outpatient setting. Apart from the hospital environment, the dietitians also work as freelancers, or what you will call a private practice. Like literally, they can have their own private clinics where they see patients face to face and one-on-one. Okay, and that cuts across various patient groups. It can be in the area of managing your weight. It can be for chronic conditions like diabetes or kidney disease or liver disease or high blood pressure or heart disease, or even patients that have had stroke before and they are seeing the dietitian in order to know how to manage their health, their dietary patterns and all of that, to be able to prevent further strokes from occurring. And there are other conditions such as osteoporosis, like bone issues. There are many more conditions like celiac disease, which has to do with gluten intolerance. There is IBS and there is IBD. There is quite a lot of conditions that I cannot begin to mention here. However, I am going to be doing videos where I will be explaining how dietitians can work with people with various chronic conditions. Okay, then maybe you'll be able to understand even more in more details, and then you can really say whether or not you watching me right now, whether you need a dietitian. I'm saying this because I've come across so many people outside the hospital who are managing chronic conditions but they don't really know that they need a dietitian to help, or do not actually know that they can benefit from the dietitian's treatment. So I have seen quite a lot of people like that. I think the reason behind that is because these people have never been admitted before at all, so they haven't even had the opportunity to see dietitians at all, and so they are not even aware that the dietitians can help them. So it's either they're only taking the medications that is prescribed to them, or they just try to do one or two things just to help themselves. Whereas if you could just see a dietitian, then you can actually benefit a great deal. So I'm going to be doing videos to address different specific conditions and how working with the dietitian can actually help you to make that management easier. Okay, if that is something. Okay, so the next question I want to answer is, do I need a dietitian? Maybe you are asking, do I need a dietitian? So if you have any medical condition that you are seeing the medical doctor for, and you know it can benefit from dietary management, you definitely need to see a dietitian, because the dietitian is the one that is registered and is protected by law to actually give you dietary treatments. All right, now how can you see a dietitian? That is the next question I want to answer for you. Your medical doctor can give you a referral to a dietitian, or better still, you can just search on the internet to see if there's any dietitian that's close to you, or you can just log on to if you are in the UK, you can log on to the BDA website, which I'm going to provide here. There you can actually search for freelance dietitians, because usually the list of freelance dietitians are always there, and you can find out the one that's close to you. Or if you're watching it today and you live in the UK, you can check out our website and see if you're close to us. You can book an appointment to see us face to face, or you can even speak to us irrespective of where you live, because we can actually have an arrangement to speak to you virtually depending on what your condition is. Then another question you are possibly going to ask me is, how is the dietitian going to assess me? How is the dietitian going to carry out assessment on me? Because I have never seen a dietitian before, so I don't even know what to expect. Now let me tell you, the dietitian is your best friend. Okay, I know that so many people misinterpret the role of a dietitian to think that we are food police. We are actually not food police. In fact, can you see this on my dress? Right now says dietitians are not food police. It's true, we are not food police. Okay, we simply help you to understand how you can make the right choices for that positive health outcome that you are looking for. That's what the dietitians do. So when you're coming to see the dietitian, please do not be anxious, okay? Because the dietitian is your friend, where all we do is to assess you holistically. Okay, we carry out your assessment in a holistic way, in the sense that we consider so many things about you. We consider your health, we consider the medications you are on, we consider your culture, we consider your religion, we consider your social life, your economic life, we even consider how what you are able and not able to do. Okay, we consider your preferences, your values. We consider too many things. We consider your body size, your image, your psychological, everything about you we consider. That is to tell you that we put you literally at the center of our practice. We just put you at the center. It all centers around you. Okay, so the dietitian is not out there to dictate for you what to eat. We don't dictate what you should eat. We literally help you, support you to make the right choices from the various options that are available to you. Okay, we tell you more about your condition. We can educate you more about your condition, and then we can educate you to know how the dietary choices you make can actually affect or impact on your condition. All right, and that information is going to help you to know how to make choices when it comes to food. This is exactly what we do. So we don't bully you to accept to eat certain things you don't like, or just say to you, stop eating that food, start to eat this food. That's not the way we work. Okay, so as dietitians, we understand that it's all about you, the client. It's all about you, the patient. Okay, it is you, because if we come up with a plan that you were not the one that actually brought about, how are we going to be sure you are going to work with that plan? You could just agree with us, and then when you leave, you will not do nothing about it. So we don't actually do that. We make sure that we work with you along the process. We literally hold your hand together, and we walk through it together until you achieve that desired outcome that you're actually looking for. This is exactly how we dietitians work. Okay, so don't be anxious when you're coming to the dietitians. Be happy, be happy, be happy. We're friendly. Okay, and all right, so the next question that I want to answer for you is, how can I trust my dietitian, or can I trust my dietitian's advice? I'm going to say big yes, you can trust your dietitian's advice. You know why I say so? You may say, why am I not speaking for myself? I say so because like I said to you in the previous explanation, the dietitian title is protected by law. So before anybody is operating as a dietitian, this person is under the watch of the regulatory body. Okay, and this regulatory body ensures that the dietitian updates him or herself every now and then. The reason is because the field of nutrition is always evolving. It's always evolving. So as it is coming up with new researches, new findings, and replacing old ones, the dietitian is updating him or herself as well with this new information. The reason is because we want to ensure that our patients or our clients are not treated with obsolete information. We're not going to be treating you with information that is out of date. We literally treat you with up-to-date information, and the only way we can ensure that is to make sure that we are updating ourselves by going through what we call a continuous professional development. Okay, and this regulatory body watches us literally, so there's no leeway. Okay, so you can be sure that when you're seeing a dietitian, you're going to have access to up-to-date information. And remember, the new diets that keep coming up every now and then, the dietitian needs to know it. We need to know the pros and cons. We need to know what the science is saying concerning it. We need to know if it is right for you or not. Okay, and we need to be able to educate you more when you come to us. So education doesn't just end in the university, or it doesn't just end in the placement that we do in the practical session in the hospitals before we are granted the competent advisor status. We are actually constantly training, and that is because we want to be able to give you up-to-date information. So yes, go with your head high up and be sure to receive the correct and the up-to-date information from your dietitian. So the next thing I want to say is that now that you've known what a dietitian is, what they do, and how they may work with you, and how you can find one, if you think you will need a dietitian, you know the next thing to do. Okay, check and see how you can get one around you. In this video, you're going to see information. You can visit our website at www.diversehealthcare.co.uk, and our dietitian page will be /DN Dietitians. So you can check on us there and see if there's any of our services we render there which you may benefit from. Okay, we also do organize physical events where we teach people how to manage their diabetes, how to manage weight, and also we consult for people face to face where they book an appointment to see us in the clinic. Okay, so and we're also very excited to come over to either your local groups or your corporate groups, your work, just to talk about nutrition. Okay, we're very passionate about public health, always looking to collaborate here and there. So it's our passion, and we are very excited to be working in this field of dietetics. So if you have any question that you want me to answer, which I haven't answered in this video, feel very free to leave it in the comment section below. I will definitely see it, and then I will come back to you with an answer. Thank you very much for watching our video today. Don't forget to subscribe to our channel, so that when we upload more videos to come soon, you are going to be able to know when those videos are uploaded. We appreciate you. Please give us a thumbs up. That will help our channel to grow. It will help YouTube to be able to show our videos to other people. We will really appreciate it, and it will not cost you anything. Thank you so much. Give us a thumbs up. Subscribe to our channel. Don't leave without just leaving a word, at least for me to know that you were there and then you watched us. Thank you so much. Bye for now, and God bless you.